Body produces a hormone called insulin, and insulin governs the delivery of blood glucose into your cells. So it feeds the cells of your body. There's different types of diabetes. You can develop diabetes where there's an absolute deficiency of insulin, commonly known as type 1 diabetes, where because you don't have that hormone, food cannot be delivered into the cells of the body. And you have to take external or exogenous insulin, basically insulin as a medication to help with managing that. The other way that you can develop diabetes is by way of insulin resistance, where the cells are not recognizing insulin to take food into the cells of the body. So that's more commonly known as type 2 diabetes. And so ultimately, the problem is one of abnormal blood glucose and abnormal methods of actually modulating blood glucose levels within the body and the delivery of glucose to the cells. So if you look at diabetes, there's the primary disease process itself, but then the reality of living with the disease is that because of that problem, which is a whole system problem, you can have all sorts of other effects on other systems in the body as it relates to diabetes. So it could be, we typically call those other complications or comorbidities. And common comorbidities in people living with diabetes include mental health illness, diabetic retinopathy or challenges with the eye. We see diabetic nephropathy or challenges with the kidney. We can see challenges with movement and activity. We can see what's called diabetic neuropathy or the impact of the disease process on the nerves, mostly the longest nerves in the body, so the feet and hands, which leads to the propensity to develop wounds and sometimes the requirement for amputation. So when we think about diabetes, it's not a simple disease process. It's something that sounds pretty simple in terms of its most basic form, but then when you think about how that affects every single cell and every single system in the body, what we end up dealing with is a very complex multi-system disease. And that's how it needs to be managed, is we're thinking about the patient as a whole and all of the things that patient experiences and can be preventative in experiencing. That's where we need to be delivering care is really in that area of whole person health. The area that I work in is really in the prevention of complications as it pertains to diabetes. And it's an area where there is vast opportunity to improve on the current standard of care. Much of diabetes care in the past, and particularly remote or in community care for the disease, has really focused on blood glucose management and the core management of diabetes, with not as much attention paid to the complications from diabetes and the prevention of complications of diabetes. So that is really where there's massive opportunity to improve the way that we deliver care and improve the way that patients are empowered to manage their own care on a day-to-day basis. As an example, if you look at the direct cost of diabetes care in the US, that's about $176 billion a year. A third of that is related to lower limb management. So not the core disease process itself, but the complications that occur in the lower leg, including peripheral arterial or vascular disease, as well as neuropathy leading to ulcers and amputation. So if we can start to think about ways that we can become more preventative, less reactive, move care into the community and outside the walls of an institution, we can really start to get a handle on the scope of what an individual faces in living with diabetes and help to really optimize not only the cost of care, but importantly, the quality of life and the health span of the people that are living with the disease. So that's really where I think that the future of medicine is going, is taking that, bridging those in-person or within the walls of an institution visit with remote patient-enabled care that's really seamless in terms of its delivery in conjunction with those systems, and getting to a place where we can just do so much better, and the experience for a patient can be so much better, where we're really thinking of that individual from a whole person context, everything that they're experiencing on an ongoing basis and support them in really the most effective way. There are new and really novel ways of addressing some of the other effects of diabetes, like the complications in the leg or the limb, including wounds and amputation. What we're seeing is that if we start to really leverage the best of connected health and remote patient monitoring, we can actually prevent those really devastating and costly wounds by 86%. So just using the right technology, engaging people in the right way, we can start to make this massive dent in the experience of diabetes, making it much more livable for people who have the disease. And then from a system perspective, much less costly, and from a provider perspective, with vastly improved outcomes. So really, it's a win-win scenario, win-win-win scenario for the patient, the provider, and the insurer to be able to engage in systems that really do leverage the best of what we have today in terms of technology and remote care. Looking today at the system that exists in healthcare, we have got a system that is overburdened, under-resourced, and that's really only going to get worse as we have an aging population with much more complex disease states than we've ever seen in the history, because we've been able to support people living with these conditions. So in order to actually move into a sustainable future and to be able to deliver the healthcare that people need and deserve, we need to start really reimagining what happens within the walls of an institution and what happens in all of the space in between. We've been practicing sick care, not health care. We need to really think about how do we bridge that entire space with connected solutions, remote care, and really optimize in the most cost-effective and streamlined way that has the patient at the center of that delivery, and delivered in a way that's completely seamless in terms of its interaction with the physical healthcare that we traditionally have been receiving, so that we're electing for the most most patient focused, the least costly, the most preventative doorways in health, versus waiting for complications to occur, being super reactive in the process, driving acute care events, driving hospital utilization, driving surgical procedures, and driving really poor outcomes at the end of the day. So how do we really shift that to be more preventative, primary care focused, and remote in its delivery? If we can completely reimagine that system, we've got all of the building blocks for a really tremendous future of healthcare. We just need to really start questioning what we've done and think about how do we futurize and modernize the healthcare system. We've got it all there. If you look at some of the most effective technology systems typically in the world, let's talk about, potentially social media or gaming, where they're very, very interactive and people are very much drawn back to those things. They typically have three things in common. One is that there's a sense of community. Two is that there's a sense of autonomy, like you have control over the destination. And then three is that you have a sense of mastery, like you can actually control the outcome. Where we see disengagement with healthcare is when we create systems that don't have those three elements, where we don't drive senses of community, we don't interact, we don't create these partnerships, where patients aren't educated or provided with the education to be able to feel like they have control over what's next, where they're not given those actionable tools and systems to be able to control what happens on a day-to-day basis, and where they don't have a feeling of mastery over that information or knowledge to be able to drive an outcome. So if we create healthcare systems that are, let's say, paternalistic in nature, where healthcare is very one-sided, it's delivered, the patient's not engaged in a process, they become disengaged, and they become disengaged in their own care and the outcome of that care. So we can start to really retool this in a way where we see that patient and provider relationship as a partnership, and probably a network of partnerships, and ensure that the best education and the most actionable education is very much built into it, and that onus and empowerment is put on the patient. We can drive way better outcomes than we've ever seen. We just have never really challenged ourselves to think about it in that way. Take the best that other engaging technologies and systems have built and start to really pull that into a healthcare context, the opportunity is very, very massive.